Welcome back to AMC Decoded for Australian Medical Council Examination Part 1. This is question 3 in our high yield practice series. Today, we are moving to pediatrics. This is a very common emergency presentation. The AMC expects you to do two things over here: accurately grade the severity of child's respiratory distress and choose the correct medication according to the Australian guidelines. Let's get started. Here is the scenario. I want you to pause the video right now, read the vignette, and lock your answer. Ready? Let's decode this. The correct answer is B. Administer oral dexamethasone. Before we talk about the drug, look at this X-ray. This is a classic Steeple sign indicating subglottic narrowing. While we rarely X-ray children with Croup, you need to recognize this image for the examination purposes. Clinically, the child had mild to moderate Croup. The key differentiator is that he has stridor only when he is agitated. When he is calm, the stridor disappears. His mental state is alert and he is not hypoxic. Australian guidelines recommend a single dose of oral corticosteroids for all children presenting with Croup, including the mild cases. Now, you must memorize these categories for the exam. Severity of Croup can be categorized as mild, moderate, and severe. For mild, there is no stridor at rest. For moderate, stridor at rest with chest wall retractions. For severe, stridor at rest, chest wall retractions, plus fatigue or hypoxia. Also watch out for this red flags. If a child is under 6 months, if the child has Down syndrome, or has represented within 24 hours. They are at high risk of deterioration and likely need admission. So, how do we treat our patient? For mild to moderate Croup, the Australian guidelines is clear. Steroids for everyone. Prednisolone or dexamethasone are given as a single dose. If oral steroids are not tolerated, we can also give budesonide 2 mg by inhalation via a nebulizer. However, if the child had severe Croup, the management changes. You must immediately give nebulized adrenaline. Adrenaline in nebulized form. And you increase the steroid dose. Instead of 1 mg per kg, you give prednisolone 2 mg per kg. Instead of dexamethasone 0.15 mg per kg, you give dexamethasone 0.6 mg per kg. Knowing the difference between 0.15 dose and 0.6 dose is often the difference between passing and failing. Now, why were the other answers wrong? A. Nebulized adrenaline. It is reserved for severe Croup. Using it in mild to moderate cases is unnecessary and requires the child to be observed for a longer period due to rebound phenomenon. C. Salbutamol. Croup is an upper airway obstruction, while salbutamol acts on the lower airways and it is used for asthma. It has no role in Croup. Option D. Neck X-ray. Croup is a clinical diagnosis. An X-ray which shows Steeple sign is rarely required and may distress the child further. worsening the obstruction. And just won't work. Option E, stem inhalation. This is old advice. It is not effective and carries a risk of burns. Let's wrap with our 4-step exam strategy. Our step 1 is the bottom line. What is the most appropriate immediate management step? We need an action now. Step 2 and step 3 are the context and cause. So step 2, a 2-year-old boy is brought to emergency department by his parents at 11 p.m. So the age is classic and the time is classic. Croup almost always presents at night. He has had runny nose for 2 days. Tonight, he woke up with a harsh, barking cough and noisy breathing. This is a buzzword. Barking cough equals to croup. Now, step 4 will be the objective findings. On assessment, the child is alert but anxious. He has audible stridor when he is crying or agitated, but stridor disappears when he is calm. There is a mild chest wall recession. His RR is 30, oxygen saturation is 98% on ROMAP, and temperature is 37.8 degrees Celsius. He is able to drink fluids. So now combining all the steps, we get the result, mild croup. And mild croup requires steroids such as dexamethasone or prednisolone, but it does not require adrenaline. And this is how you manage croup safely. Thank you for watching. If this helped, please hit like and subscribe. I will catch you in the next video.